Calcemia. Calcium deposition in the brain, vascular calcification, excess calcium accumulates in the blood vessels and small blood vessels of the brain, creating vascular calcification. This reduces the elasticity of blood vessels and makes the walls stiff and narrow. Blockage in blood vessels and high blood pressure due to vasoconstriction and blockage, blood flow to the brain decreases. Increasing vasoconstriction also increases blood pressure, hypertension. High blood pressure itself increases blood vessel damage and blockage, a cyclical problem. Cause of ischemic stroke: if blood flow suddenly stops to any part of the brain, the nerve cells there die due to lack of oxygen and nutrients. This condition is called ischemic stroke. Vitamin D-induced vascular calcification and high blood pressure directly increase the risk of ischemic stroke. Scientific evidence. According to the Journal of Stroke and Cerebrovascular Diseases, 2018, excess of vitamin D increases vascular calcification, causing blockage of blood vessels in the brain, which increases the risk of ischemic stroke. The American Heart Association report states, hypercalcemia and vascular stiffening are major causes of high blood pressure and stroke. Excessive vitamin D increases the level of calcium in the body. Excess calcium accumulates in the blood vessels of the brain, causing blockage and high blood pressure. As a result, blood circulation in the brain is disrupted, which can lead to ischemic stroke. Therefore, vitamin D supplements should definitely be taken according to the advice of a doctor. The role of vitamin D is essential for bone and muscle health, especially for the elderly. It helps to increase calcium absorption and prevent osteoporosis. Physiological changes in the elderly: as age increases, kidney function decreases, which causes problems in controlling vitamin D and calcium levels. Vitamin D metabolism in the elderly is slow, and excess vitamin D can accumulate in the body. Why is more than 4,000 IU of vitamin D risky? A. Hypercalcemia risk: more than 4,000 IU of vitamin D can increase excessive calcium absorption and cause hypercalcemia. Hypercalcemia increases the risk of kidney stones, kidney damage, and heart disease. B. Effect on the kidneys: the kidneys of the elderly are naturally weak. Excessive vitamin D reduces function by depositing excess calcium in the kidneys. C. Cardiovascular risk: excess calcium increases the thickness of blood vessels, increasing the risk of heart attack and stroke. Vitamin D. Final thoughts: the bodies of the elderly cannot properly metabolize excess vitamin D. Taking more than 4,000 IU of vitamin D supplements can lead to excessive calcium absorption, hypercalcemia, and kidney and heart problems. Therefore, vitamin D intake for the elderly should always be as per doctor's advice and in controlled doses. Now we will discuss vitamin K. 1. What is vitamin K and what is its role? Vitamin K is a fat-soluble vitamin that mainly plays an important role in the process of blood clotting. It is essential for the production and activation of clotting factors, which stop bleeding. 2. What happens if vitamin K is excessive? If vitamin K is taken in excessive amounts, the blood clotting process becomes overly active. As a result, the tendency for blood to clot increases, which can cause thrombosis. 3. Relationship between stroke and vitamin K. If excessive blood clots form inside the blood vessels of the brain, it obstructs the flow of blood. In this condition, blood vessels become blocked, which is the main cause of ischemic stroke. If there is excessive vitamin K, the risk of blood clotting increases, which also increases the possibility of stroke. Scientific evidence: thrombosis research. 2017 research states, high doses of vitamin K supplementation can increase the risk of blood clotting, which can cause cardiovascular events such as stroke and heart attack. The American Heart Association report states, it is essential to keep vitamin K levels properly controlled to control blood clotting, as excessive vitamin K increases the risk of stroke. Vitamin K plays an important role in blood clotting. Taking excessive vitamin K increases blood clotting, increasing the risk of blood vessel blockage. Ischemic stroke can occur if blood flow to the brain is obstructed. Therefore, vitamin K supplementation should be taken according to the advice of a doctor. 1. What is vitamin K? Vitamin K is a fat-soluble vitamin. It is mainly very important in the process of blood clotting. 2. Necessity of blood clotting: when there is an injury or damage, blood starts to flow. It is essential for the body to stop bleeding. Otherwise, excessive blood loss can occur. This is done by the process of blood clotting. 3. The role of vitamin K. Vitamin K is needed to create a group of proteins that are important for blood clotting. These proteins are called clotting factors, such as factor 2, prothrombin, factor 7, 9, and X. Vitamin K causes a special chemical change, gamma carboxylation, of these proteins, which activates them. Activated clotting factors work with blood, platelets, and fibrin to help clot blood. 4. Brief description of the blood clotting process. Platelets accumulate at the site of injury, gradually forming a plug. Clotting factors become activated and create fibrin threads, which strengthen the platelet plug. Clotting factors made with the help of vitamin K play an essential role in these steps. 5. Scientific evidence. Research has shown that a deficiency of vitamin K reduces the ability of blood to clot, which results in prolonged bleeding. And if vitamin K is sufficient, the body can quickly stop bleeding. Vitamin K is essential for the blood clotting process of the body. It helps to create and activate clotting factors, which stop bleeding. Without vitamin K, it is difficult to stop bleeding. 1. What is vitamin K and what is its role? Vitamin K is a fat-soluble vitamin that is essential for blood clotting. It activates the clotting factors needed for blood clotting. 2. What happens if you take too much vitamin K? If vitamin K is excessive, the clotting factors become more active. As a result, there is an abnormal or excessive tendency to clot in the blood, hypercoagulability. These extra clots can get stuck in blood vessels, which is known as thrombosis, clot. 3. Blockage in the brain and risk of stroke. When a thrombus gets stuck in the blood vessels of the brain, blood flow is obstructed. Due to this, a specific part of the brain is deprived of oxygen and nutrients. This condition is the cause of ischemic stroke. What Science Says. Research published in thrombosis research and stroke journals has shown that excessive vitamin K intake increases hypercoagulability and the risk of blood vessel blockage in the brain. The American Heart Association has said that the balance of vitamin K in the blood clotting process is important, as excessive vitamin K can increase the risk of stroke. Excessive vitamin K intake increases the tendency for blood to clot. This can cause thrombosis in the brain, which blocks blood vessels and causes ischemic stroke. Therefore, doctors' advice should be taken when taking vitamin K supplements. 1. What is warfarin and how does it work? Warfarin is an anticoagulant, blood thinner, drug, which reduces blood clotting. It inhibits the activity of vitamin K, especially reducing the activity of clotting factors. As a result, the blood remains thin and the risk of thrombosis or blockage is reduced. 2. The role of vitamin K. Vitamin K is needed to create and activate clotting factors 2, 7, 9, and X. Warfarin reduces the effectiveness of these vitamin K-dependent clotting factors. 3. Excessive vitamin K and the antagonism of warfarin. If excessive vitamin K is taken while taking warfarin, vitamin K interferes with warfarin's work. If vitamin K is excessive, the production of clotting factors increases and warfarin's blood thinning ability decreases. As a result, the risk of blood clotting increases, which can cause heart attack, stroke, or other blockages. 4. Possibility of dangerous conditions. If the dose of warfarin is not right, or if excessive vitamin K is taken, blood clotting increases again. This can cause blood vessel blockage, stroke, heart attack, or other life-threatening complications. Scientific evidence. A study in the American Journal of Medicine has shown that if warfarin users cannot maintain the correct level of vitamin K intake, the risk of both thrombosis and bleeding increases, according to Clinical Pharmacology and Therapeutics. Controlling the level of vitamin K is essential for the success of warfarin therapy. Warfarin reduces the effectiveness of the blood-thinning drug vitamin K. Excessive vitamin K interferes with warfarin's work, which increases the risk of blood clotting. Therefore, it is very important for people taking warfarin to control the amount of vitamin K supplements or food and follow the advice of a doctor. Now we will discuss. 1. The role of iron. Iron is an essential mineral for the production of hemoglobin in the blood. Hemoglobin carries oxygen through the blood to various organs of the body. Iron deficiency causes anemia. 2. Necessity of taking iron supplements. Iron supplements are given to treat anemia or iron deficiency. However, excessive iron supplements can create health risks. 3. Why does the blood thicken when taking excessive iron supplements? Excess iron accumulates in the body and increases the hemoglobin and hematocrit levels in the blood. As a result, blood viscosity increases. Thick blood flows slowly and is more likely to clot. 4. Risk of stroke due to blood thickening. When the blood is thick, blood flow through the blood vessels is obstructed. The risk of blood clotting increases, which can block blood vessels in the brain and cause ischemic stroke. In addition, the risk of heart disease also increases due to thick blood. Scientific evidence. A study in the Journal of Thrombosis and Hemostasis states high iron levels increase blood density and the risk of thrombosis. Research published in the Stroke Journal states patients with iron overload are more likely to have stroke and other cardiovascular problems. Although iron supplements are necessary, excessive intake thickens the blood. If the blood is thick, the risk of clotting and stroke increases. Therefore, iron supplements should be taken according to the advice of a doctor and through regular blood tests. 1. The role of iron. Iron is an essential mineral that helps make hemoglobin and myoglobin. Hemoglobin is essential for carrying oxygen in the blood. 2. Excessive iron accumulation in the body. Iron overload. When excess iron accumulates in the body, the concentration of iron in the blood increases. This increases the hematocrit and hemoglobin levels in the blood and thickens the blood. Hyperviscosity. Thick blood flows slowly and increases the risk of blood vessel blockage. 3. Increased oxidative stress. Iron-free iron ions, Fe superscript 2 or Fe superscript 3, help produce free radicals, especially through the Feri-Fantal reaction. Free radicals are highly reactive molecules that damage cell and tissue DNA, proteins, and lipids. As a result, oxidative stress increases in the body, which can cause various complications. 4. The effects of oxidative stress increase cell damage and inflammation. Increased risk of various chronic diseases, including heart disease, kidney disease, and liver disorders, damage to blood vessels and heart endothelial cells, which can cause blockages and strokes. What science has proven in research. A study published in the journal Free Radical Biology and Medicine states excess iron increases the production of free radicals, increasing oxidative stress and cell damage. According to blood reviews, patients with iron overload are more likely to have heart disease and stroke. Excess iron thickens the blood and slows blood flow. Iron-free ions increase oxidative stress and damage cells and tissues. Therefore, iron supplements and intake should be at the advice of a doctor and in controlled amounts. 1. The role of iron and excess. Although iron is important for carrying oxygen in the body, excess iron is harmful to the body. When there is iron overload, iron accumulates in various organs and increases oxidative stress on cells and tissues. 2. Causes of increased blood pressure. Excess iron creates oxidative stress on the endothelial cells, RBC lining cells, of blood vessels, which increases the thickness and contraction of blood vessels. Due to the constriction of blood vessels, blood flow is obstructed and blood pressure increases. Hypertension. In addition, blood clotting and blood density increase due to iron, which creates obstacles in blood flow. 3. Abnormal heart rate. Arrhythmia. Excess iron accumulates in the heart muscle and impairs muscle function. Iron's oxidative stress disrupts the transmission of electrical signals in the heart, resulting in abnormal heart rate. Arrhythmia. When there is arrhythmia, the blood cannot pump properly, which reduces blood flow to the brain. 4. Stroke risk. Due to high blood pressure and abnormal heart rate, blood flow to the brain is obstructed. In this condition, any part of the brain may become ischemic stroke due to lack of oxygen and nutrients. In addition, blood thickening due to iron also increases stroke risk. Research published in the journal Circulation Research states that iron overload damages heart muscle and blood vessels, which can cause hypertension and arrhythmia. Stroke Journal has found that high blood pressure and arrhythmia are major causes of ischemic stroke. Excess iron increases blood pressure by increasing the constriction and thickness of blood vessels. It accumulates in the heart muscle and causes abnormal heart rate. High blood pressure and arrhythmia together increase the risk of stroke in the brain. Therefore, it is very important to keep iron levels under control. 1. What is hemochromatosis? Hemochromatosis is a genetic disease in which the body absorbs and stores excess iron. This excess iron mainly accumulates in the liver, heart, pancreas and other organs and causes disease. 2. Harmful effects of excess iron. Iron-free ions, Fe superscript 2 or Fe superscript 3, create free radicals, which cause oxidative stress and inflammation in cells and tissues. As a result, the function of organs decreases and fibrosis, scar tissue, forms. Complications such as liver damage, cirrhosis, heart abnormalities, and diabetes occur. 3. The risk of excess iron and hemochromatosis. In patients with hemochromatosis, the body's iron control system is weak, so they are easily exposed to excess iron accumulation. Excess iron deposition quickly damages organs and intensifies the complexity of the disease. The risk of blood thickening, high blood pressure, abnormal heart rate, and stroke increases. In hemochromatosis, the body absorbs and stores excess iron, which damages various organs. For these patients, taking excess iron or iron accumulation is risky. Regular treatment and iron level control is essential. And finally, the topic we will discuss. 1. The role of calcium and vitamin D. Calcium is essential for building bones and contracting muscles in the body. Vitamin D helps the body absorb calcium. These two elements are usually taken together to maintain bone health. 2. Consequences of taking excess calcium and vitamin D. If there is more vitamin D, calcium absorption from the intestine is excessive. Excess calcium accumulates more in the blood, which can accumulate in the arteries, blood vessels. 3. The deposition process in arteries, vascular calcification. Calcium and phosphate accumulate in the arterial wall and take the form of a hard solid tissue. This deposit is called vascular calcification. This hardens and narrows the artery, which creates an obstruction to blood flow. 4. Risks and effects. Arterial constriction and hardening increase blood pressure. The risk of blood vessel blockage or heart attack and stroke increases. In the long term, the possibility of arterial inflammation and heart disease increases. According to the Journal of the American College of Cardiology, 2018, taking excess calcium and vitamin D increases the risk of vascular calcification and cardiovascular disease. Research published in Kidney International Journal has shown that excess calcium and vitamin D increases arterial deposition in kidney patients. Although calcium and vitamin D are needed for the body, excessive intake can cause deposition in the arteries. This deposit narrows and hardens the arteries and increases the risk of heart disease and stroke. Therefore, these supplements should be taken according to the advice of a doctor. 1. The role of calcium and vitamin D. Calcium is essential for the normal functioning of bones, teeth, and muscles. Vitamin D helps to absorb calcium and control its level in the blood. For this reason, the two are taken together to meet the calcium needs of the body. 2. Taking excess calcium and vitamin D. Excess vitamin D increases the absorption of calcium from the intestine. This results in a higher than normal level of calcium in the blood. Hypercalcemia. Excess calcium in the blood can accumulate in various organs and cause problems. 3. The process of calcium deposition in arteries. Arterial calcification. Excess calcium deposition in the arterial wall is known as vascular calcification. It reduces the flexibility of the arteries, hardening and narrowing the arterial walls. Calcium phosphate clots combine with arterial cells to form a type of hard tissue. 4. Risks and effects. Loss of arterial flexibility causes high blood pressure. If blood flow is obstructed, the risk of heart attack, stroke, and other cardiovascular diseases increases. In the long term, arterial inflammation and fibrosis can occur. Excess calcium and vitamin D together increase the level of calcium in the blood. This causes calcium to accumulate in the arteries, reducing arterial flexibility and increasing constriction. This increases the risk of heart disease and stroke, among others. Therefore, control of these supplements and doctor's advice are essential. 1. The effects of excess calcium and vitamin D. When vitamin D is high, calcium absorption from the intestine increases, resulting in an increase in the level of calcium in the blood. Excess calcium can accumulate in blood vessels and arterial walls. Vascular calcification. 2. Calcium deposition in brain blood vessels and its effects. When calcium accumulates in the arteries and blood vessels of the brain, the flexibility of the arteries decreases and they become narrow. Blood flow is obstructed. Through narrowed arteries, so the brain does not get enough oxygen and nutrients. 3. Increased risk of stroke and TIAs, transient ischemic attacks. Due to reduced blood flow, there is a lack of oxygen and nutrients in any part of the brain, which can cause ischemic stroke or mini-stroke, TIAs. TIAs are temporary reductions in blood flow, which may be a precursor to a full-fledged stroke in the future. Conclusion: taking excess calcium and vitamin D together increases calcium deposition in the blood vessels of the brain. Stroke and TIAs risk increase due to reduced blood flow in the brain as a result of arterial constriction. Therefore, this supplement intake should be done as per doctor's advice and in controlled amounts. 1. The need for calcium 1000-1200 mg for the elderly. Bone density decreases with age, which increases the risk of osteoporosis. Calcium is the main building block of bone, which helps keep bones strong and healthy. Studies have shown that taking 1000 to 1200 milligrams of calcium daily prevents bone loss and reduces the risk of bone fractures. However, exceeding this level can cause excessive calcium to accumulate and cause arterial problems. 2. The need for vitamin D 800 IU. For the elderly, vitamin D plays an important role in calcium absorption in the body. The ability to produce vitamin D from the skin decreases in the elderly, and less vitamin D is obtained from sunlight. Taking 800 IU of vitamin D daily keeps bones healthy and reduces the risk of fractures. Excess calcium absorption is controlled if the safe level can be maintained. 3. Importance of maintaining safe levels. Various problems can occur if calcium and vitamin D are not taken in the right amounts or are taken in excess, such as excess calcium, deposition in arteries, high blood pressure, increased stroke risk, excess vitamin D, hypercalcemia, kidney problems. Therefore, it is important to control the level according to doctor's advice. Calcium 1000-1200 mg and vitamin D 800 IU daily is safe and effective for bone and overall health in the elderly. If this level is controlled according to the advice of a doctor, bone loss and other risks are reduced. Take doctor's advice before taking all supplements and protein-rich foods. As age increases, the body's reserve capacity decreases, so the risk of overdose is higher. It is important to be more careful if there is a family history of stroke. This is what must always be kept in mind. So from today's informative discussion, we understand that any vitamin can be beneficial, but if it goes beyond the limit, it can be dangerous, especially for the elderly. So before taking vitamins, it is wise to seek doctor's advice instead of making your own decision. Your health is your future. Eat according to the rules. Stay healthy. If you like the video, like it, share it with your loved ones, and don't forget to subscribe to the NTG Healthcare 360 channel. See you in the next video with some new health information. Be well, stay safe.